Good afternoon, dear students. Today we have with you topic of the lecture, anti-inflammatory drugs. Today we'll discuss with you two big groups of drugs, steroidal anti-inflammatory agents and non-steroidal anti-inflammatory agents. So we'll begin with you from definition of inflammation. Inflammation is a complex, protective response of the organism to injury caused by damaging agents. It is aimed at an activation or removal of these agents and promoting healing. The traditional names for signs of inflammation come from Latin. You know these words: dolor, which means pain; color, which means heat; rubor, which means redness; tumor, it means swelling; and functionalism, loss of function. And here we can see with you four signs of inflammation. Four signs: redness, heat, swelling, and pain. Redness and heat due to the local vessel dilation. Swelling due to influx of plasma proteins and phagocytic cells into the tissue spaces. Pain due to local release of enzymes and increased tissue pressure. The main mediators of inflammation are prostaglandins, bradykinin, serotonin, histamine, interleukins, platelet activating factor, gamma interferon, tumor necrosis factor, transforming growth factor, and the main role of some biological active substance in the body, the main mediators of inflammation. Prostaglandin E2. So it is releasing is accompanied with vasodilation, bronchodilation, inhibition of gastric acid secretion, stimulation of gastric mucus secretion, sensitization of pain receptors to chemical and mechanical stimuli, promotion to anterior pituitary hormones release. Prostaglandin A2 alpha, uterus contraction, bronchoconstriction, decrease in intraocular tension. Thromboxane A2, produced, by platelets. Production of these biological active substance leads to the induction of platelet aggregation, vasoconstriction. Prostaglandin E2 leads to the inhibition of platelet aggregation and potent vasodilations. The main representative of these prostaglandins, it is prostacyclins, which has opposite effect to the thromboxane. And you know that the main enzyme which is inhibited by the main group of anti-inflammatory drugs, non-steroidal, this is cyclooxygenase. And we have to discuss with you role and types of this enzyme. Cyclooxygenase exists in the tissue as constitutive isoform. This type is COX-1, constitutively expressed in wide variety of cells all over the body. So in physiological conditions, it means like housekeeping enzyme exists to gastric cytoprotection, hemostasis. It plays a role in maintaining gastrointestinal mucosal lining, kidney function, and platelet aggregation. Cyclooxygenase at the site of inflammation, cytokines stimulate the induction of the second isoform, COX-2. In this simple enzyme, dramatically upregulated during inflammation, Inhibition of COX-2 is thought to be due to the anti-inflammatory action of non-steroidal anti-inflammatory drugs. Inhibition of COX-1 is responsible for their gastrointestinal tract toxicity. Most currently used NSAIDs, this is abbreviation of non-steroidal anti-inflammatory drugs, are somewhat selective for COX-1, but selective COX-2 inhibitors are available too. So we'll begin to discuss with you the group non-steroidal anti-inflammatory drugs. The abbreviation NSAID that I told you at previous slide. And we'll begin with you from the classification. So the classification due to the mechanism of action. I told you that these drugs, they inhibit cyclooxygenase, and drugs which non-selective COX inhibitors which block both and COX-1 and COX-2. There are salicylates. Acetyl-salicylic acid is very famous and known as the drug aspirin. Pyrazolone derivatives, Metamizole. Indole derivatives, indomethacin. Propionic acid derivatives, naproxen, ibuprofen, ketoprofen, dexketoprofen, flurbiprofen, and naproxen. Anthranilic acid derivatives, mefenamic acid, aryl acetic acid derivatives, very popular drug, it is diclofenac sodium, aceclofenac. Oxycam derivatives, piroxicam, tinoxicam. Dihydropyrrolizine carboxylic acid derivative, ketorolac. The next group of drugs which blocks COX selectively. Selective COX inhibitors, preferential COX-2 inhibitors, nimesulide, meloxicam, nabometon, etodolac. And selective COX-2 inhibitors, celecoxib, parecoxib, rofecoxib, etoricoxib, and valdecoxib. So, it is important to pay attention that these drugs cause little gastric mucosa damage due to the inhibition of the COX-2 enzyme. They do not inhibit platelet aggregation. So, act by inhibiting cyclooxygenases, it means that there is no prostaglandin production. There are three types of COX. We discussed with you COX-1 and COX-2. COX-1 constitutively expressed and the main role is housekeeping function. COX-2 induced by pro-inflammatory factors, so the play of inflammation. COX-3 just recently discovered. Prostaglandins do not cause pain, but sensitize receptors to stimulation by 5-HT bradykinin capsaicin. Interleukin-1 released from activated macrophages, bacteria, etc. induce COX-2 in the brain. Prostaglandin A produced affects thermoregulation, leads to the fever, and says they block cyclooxygenase, and it means that they have antipyretic effects, antipyretic activity. Classical non-steroidal anti-inflammatory drugs, they inhibit both COX-1 and COX-2. Inhibition is reversible with the exception of acetyl-salicylic acid, and the main name is aspirin. So, lead to the decreasing of the level of housekeeping prostaglandins and leads to the side effects, main side effects, gastrointestinal, bronchospasm. The second generation non-steroidal anti-inflammatory drugs specific to COX-2, which inhibit selectively COX-2, they have only the inflammatory responses inhibited, and it means that they have less side effects. The main mechanism of anti-inflammatory drugs action, anti-inflammatory drugs action, especially for non-steroidal anti-inflammatory, so I'll show to you. So you know that the main components of cell membrane which synthesize to the destroying of cell membrane during inflammation, phospholipids. So then arachidonic acid is synthesized from phospholipids, and the enzyme which plays the role in this one, this is phospholipase A2. Then arachidonic acid is transformed to cyclic endoperoxidases. So endoperoxidases are prostaglandins and thromboxane. Prostaglandins leads to the inflammation, pain, fever. Thromboxane leads to the vasoconstriction and increasing of platelets aggregation. And I want to pay attention that there are two main groups of drugs with anti-inflammatory activity: glucocorticosteroids, or another name steroidal anti-inflammatory agents, which blocks phospholipase A2. And the drugs that we discuss with you, non-steroidal anti-inflammatory drugs, they block enzyme cyclooxygenase. The main pharmacological effects of NSAIDs: anti-inflammatory, analgesic, decrease the pain, antipyretic, decrease the temperature, antiplatelet. Usually we use acetyl-salicylic acid with antiplatelet effect, and closure of ductus arteriosus in newborn. Clinical uses of NSAIDs. So in what disease will you administer this group of drug? We use it in pain, headache, toothache, myalgia, back pain. In the case of fever, during sickness, arthritis, rheumatoid arthritis, osteoarthritis, gout, which also is accompanied with the symptoms of arthritis, and also ankylosing spondylitis. Dysmenorrhea, especially ibuprofen is used in this. Closure of ductus arteriosus. For prevention of myocardial infarction, we use this drug. For stroke and reinfarction. So the drug which is used for the last therapeutic usage is acetyl-salicylic acid. So the main side effects of non-steroid anti-inflammatory drugs: gastrointestinal, peptic ulcer, and multiple microeruptions. Erosive damaging of large and small intestines. The mechanism of these gastric adverse effects are likely due to the inhibition of COX-1. I paid attention on this one. I told you that inhibition of COX-1, inhibition of housekeeping prostaglandins. So it leads to the prevention, the creation of prostaglandins that protect the gastric mucosa. The damage is more likely in patient that has a prior history of peptic ulcers. Since it is COX-1 specific, the use of COX-2 selective NSAID is a low-risk alternative. So we have to determine with your risk-benefit and to choose correct drug. If you know about ulcer of the stomach, of the duodenum in anamnesis of the patient. Then kidney, reversible acute kidney insufficiency, water electrolyte disorders, chronic kidney insufficiency, and interstitial fibrosis, interstitial nephritis, nephritic syndrome. Renal adverse effects are because COX-1 and COX-2 facilitated the production of prostaglandins that play a role in renal hemodynamics. In a patient with normal renal function, inhibition of prostaglandin synthesis does not pose large problem. However, in patients with renal dysfunction, these prostaglandins play a greater role and can be the source of problems when reduced via non-steroidal anti-inflammatory drugs. Complications that can occur include acute renal dysfunction, fluid and electrolyte disorders, renal papillary necrosis, and nephrotic syndrome that I told you. Cardiovascular increasing of the arterial hypertension is the main side effect of non-steroidal anti-inflammatory drugs, increasing of static cardiac insufficiency, and increasing of stenocardia. Cardiovascular adverse effects can also be increased with the NSAID use. So these include maybe also myocardial infarction, maybe thromboembolic events, and atrial fibrillation. Diclofenac seems to be the NSAIDs with the highest reported increase in adverse cardiovascular events. So remember about it. And I want to tell you that selective COX-2 inhibitors, especially COX-IBs, that leads to the thrombosis. Then liver, increasing of transaminases level, life-threatening liver insufficiency. So adverse effects which is in connection with the liver function disorder can also be increased with non-steroidal anti-inflammatory use. And hepatic adverse effects are less common. NSAIDs associate risk of hepatotoxicity is not very common. And liver-related hospitalization is very rare. So among the various non-steroidal anti-inflammatory agents, diclofenac has a high rate of hepatotoxic effects. CNS disorders may be headache, somnolence, confusion, disorders of behavior, and aseptic meningitis. Also, blood system, the hematological adverse effects are possible, particularly with non-selective non-steroidal anti-inflammatory drug, due to their antiplatelet activity. So we have the main adverse effect, this is thrombocytopenia. The antiplatelet effect typically only poses a problem if the patient has also a history of the gastrointestinal ulcer, a disease that impairs platelet activity, thrombocytopenia, von Willebrand hemophilia, and in some perioperative cases. Maybe granulocytopenia and aplastic anemia. Boyne's joint disorder of cartilage, maybe, and another side effects increasing of asthma, skin rash, so allergic reaction. Contraindications for non-steroidal anti-inflammatory drugs. So they are contraindicated for pregnant women, hemophilic patients, In the case of hypersensitivity reactions, also viral infections mainly in children, so especially for acetyl-salicylic acid, it can cause Reye syndrome. We'll discuss it later. And peptic ulcers are also contraindicated for usage of non-steroidal anti-inflammatory agents. Drugs interaction potentiates the gastroirritant effect of alcohol, so it is contraindicated with alcohol usage. Potentiates the hypoglycemic effects of oral hypoglycemic drugs. Diuretics decrease diuresis if we use it together with NSAIDs. Beta blockers decrease antihypertensive effect. AC inhibitors, angiotensin converting enzyme inhibitors decrease the antihypertensive effect. Anticoagulants, if we use together with NSAID, can lead to the increasing of gastrointestinal bleeding. Cyclosporine increases nephrotoxicity. Glucocorticosteroids or steroidal anti-inflammatory drugs increase also the gastrointestinal bleeding. And now we'll discuss with you about drugs which are used nowadays very often. The salicylates, acetyl-salicylic acid, duration of action about 4 hours. It is orally taken, weak acid, hydrolyzed by esterases in tissue and blood, more salicylase conversion in liver, and rapidly excreted by kidneys. Acetyl-salicylic acid, it is used as antipyretic analgesic agents. Anti-inflammatory, it is used for the treatment of rheumatic fever, rheumatoid arthritis, joint disease, and another rheumatological disease. But for treatment of this disease, very high dose is needed, about 5 to 8 grams per day. But many patients cannot tolerate these doses. So, propionic acid preventives, ibuprofen, naproxen, tried to use first. Prophylaxis of disease due to platelet aggregation. And also, I want to pay attention that acetyl-salicylic acid is used for the treatment of preeclampsia and hypertension during pregnancy. Contraindication for acetyl-salicylic acid in patients who are sensitive to it and allergic reaction, and in peptic ulcer and bleeding. In children suffering from chickenpox or influenza due to the risk of Reye syndrome, it means liver encephalopathy can appear in children due to the usage of acetyl-salicylic acid. In chronic liver disease, cases of hepatic necrosis have been reported. Acetyl-salicylic acid should be stopped 1 week before elective surgery, dental extraction, because of the reason that this drug can cause bleeding. Also, the main drug which is used nowadays, very often, very common drug, this is ibuprofen. Pharmacokinetics of this drug, it is rapidly absorbed after oral ingestion. Half-life 2 hours. Highly bound to plasma proteins excreted through kidney as metabolites. Ibuprofen, the same mechanism and the same pharmacological actions as acetyl-salicylic acid, as aspirin, except that it is reversible inhibitor for COX enzymes, more potent as anti-inflammatory than acetyl-salicylic acid. Clinical uses. It is used as analgesic, antipyretic, anti-inflammatory, and also in acute gouty arthritis, patent ductus arteriosus, and children. Preparations of ibuprofen. There are several forms of ibuprofen. Maybe oral preparations, topical cream which I use for osteoarthritis, a liquid gel for rapid relief of post-surgical dental pain. Thermal patch also an intravenous route as in patient ductus arteriosus. Adverse effects of ibuprofen. Gastric upset, less frequent than acetyl-salicylic acid. Fluid retention, which leads to the edema and can lead to increase of arterial pressure. Hypersensitivity reactions, now don't forget about the allergic reaction. Maybe ocular disturbances and rare hematological effects, erythrocytosis and aplastic anemia. Contraindications. Ibuprofen is contraindicated to the patient with peptic ulcer, with allergic patients also to acetyl-salicylic acid. Kidney impairment, liver disease, it is contraindicated in pregnancy, and hemophilic patients. The concomitant administration of ibuprofen antagonizes the irreversible platelet inhibition of acetyl-salicylic acid. So remember, if we use acetyl-salicylic acid, for example aspirin cardio, as anti-aggregant drug, ibuprofen can decrease this antiplatelet activity and limit cardioprotective effect of aspirin. Diclofenac is also used nowadays very often. Mechanism of action the same as ibuprofen. It is non-selective inhibitor for COX-1 and COX-2 enzymes, more potent as anti-inflammatory than analgesic and antipyretics. Clinical uses. It is used as anti-inflammatory conditions. So it is used in any inflammatory conditions. Musculoskeletal pain, dysmenorrhea, acute gouty arthritis, fever, locally to prevent or treat post-ophthalmic inflammation, and also used as topical gel for solar keratosis. Adverse effects of diclofenac. Also the same as ibuprofen, acetyl-salicylic acid, gastric upset. Then renal impairment, elevation of serum aminotransferases. I paid your attention that diclofenac has a hepatotoxicity. And salt and water retention that can also lead to the increasing of arterial pressure. So, and be careful during administration to the patient with higher blood pressure. Preparations of diclofenac with misoprostol decrease upper gastrointestinal ulceration, but result in diarrhea. So, you know this drug is misoprostol. It is a prostaglandin E, which is used for the treatment of gastritis, which is caused by non-steroidal anti-inflammatory drug. Diclofenac with omeprazole to prevent recurrent bleeding. So omeprazole, you remember this is the drug which is proton pump inhibitor, and we use it together with non-steroid anti-inflammatory agents if we use it for a long period of time to prevent recurrent bleeding. Ulceration also. 1% of ophthalmic preparation for post-operative ophthalmic inflammation. So this preparation of diclofenac is used in ophthalmology. A topical gel, 3% for solar keratosis, and rectal suppository as analgesic or for post-operative nausea. Selective COX-2 inhibitors, we discussed with you such drugs as nimesulide, etodolac, meloxicam, nabometon, and the advantages of these drugs: they're highly selective inhibitors of COX-2 enzymes. They have potent anti-inflammatory activity, have analgesic and antibiotic properties, and highly bound to plasma proteins. Selective COX-2 inhibitors, they have lower incidence of gastric upset and no effect on platelet aggregation because they don't affect COX-1 enzyme. Also, pay attention that they can cause renal toxicity, and they are not recommended for patients with severe renal insufficiency. High incidence of cardiovascular thrombotic events, with some of them as rofecoxib, which can lead to the thrombosis, and it was known in randomized clinical trials. So also they are recommended in post-operative patients undergoing bone repair. Also, it is indicated in primary familial adenomatous polyposis, dysmenorrhea, acute gouty arthritis, acute musculoskeletal pain, and ankylosing spondylitis. Also, selective COX-2 inhibitors, they are recommended in post-operative patients undergoing bone repair. Also indicated in primary familial adenomatous polyposis, dysmenorrhea, acute gouty arthritis, acute musculoskeletal pain, and ankylosing spondylitis. Nimesulide is selective inhibitor of COX-2. So it inhibits inflammation process, and it does not affect the synthesis of thromboxane. Also, I want to pay your attention that nimesulide can lead to the liver function disorder, can lead to the liver insufficiency, severe liver insufficiency, also to severe allergic reaction, severe skin disease, which is allergic. And I want to pay attention that the usual course of usage of nimesulide is about 5-7 days. So no more than 2 weeks because of side effects of these drugs. Meloxicam are used in rheumatoid arthritis. COX-2s are also very often are used in rheumatism. And I want to discuss with you two drugs which are used very common. One drug is Metamizole, which inhibits both COX-1 and COX-2. But this drug doesn't have anti-inflammatory activity. Usually it is used as antipyretic and as analgesic drug. So this drug is contraindicated for usage in a lot of countries, in Europe, in United States of America, in Australia, but it is used in Russian Federation, it is used in India. So, and I want to pay your attention so that the usage of metamizole is limited in these countries due to the agranulocytosis, aplastic anemia, also kidney damage leads to the nephritis, hepatitis, alveolitis, and severe skin disease. And I want to pay attention on paracetamol. Paracetamol, this is the drug which doesn't have also anti-inflammatory activity. It has only analgesic and antipyretic activity. Paracetamol inhibits the synthesis of prostaglandins in the central nervous system. So that's why it has central analgesic and antipyretic activity. Paracetamol is the most preferable drug and it is safe drug, but you have to remember that during long usage of paracetamol leads to the nephropathy and can lead to the terminal kidney insufficiency. So, nephrotoxic action of metabolites of paracetamol. And you have to remember about hepatotoxicity of paracetamol, especially in usage of big dose. So the main antidote in the case of overdosage of paracetamol, it is the native glutathione. This is acetylcysteine. And I want to tell you that two drugs, paracetamol and ibuprofen, are indicated for usage in children, and other drugs are contraindicated. So now break 5 minutes and then we'll continue. Steroidal anti-inflammatory steroid drugs. They are divided into several groups due to the time of action: short-acting glucocorticoids, natural, hydrocortisone, cortisone, intermediate-acting glucocorticoids, prednisone, very famous prednisolone, nowadays it is popular methylprednisolone, triamcinolone, long-acting betamethasone, dexamethasone is also very popular nowadays, and paramethasone. Topically acting glucocorticoids. I want to tell you that we can divide this group of drugs into two. Drugs for inhale glucocorticoids. There are beclomethasone, budesonide, fluticasone. Also, triamcinolone also can be used as inhale glucocorticoids. And drugs which are used topically on skin, in cream: fluocinolone, fluocortisone, betamethasone, clobetasol. So you can see at this picture the main agents of glucocorticoids, then the dose for these drugs in tablet suspensions, and the dose in injections. So we see that betamethasone, there are drugs form in tablets and suspension, also in injections. For dexamethasone, injection for hydrocortisone and tablets and injection. Methylprednisolone, the tablets which has 16 milligrams and 4G80 milligrams by milliliter for drugs which includes methylprednisolone for injections. Also, we see with you methylpred and the big dose 500 milligram to 8 milliliter. Prednisone, it is used in suspension and in tablets. Prednisolone in tablets, and also we have with you in injections form several forms, drug forms. So here we have with you classification due to the potency of glucocorticoids. Weak, but I want to pay attention that the main drug form cream. So drugs which are used locally on skin area. So hydrocortisone acetate. Hydrocortisone is weak glucocorticoid. Moderate, there are betamethasone, valerate, fluticasone, propionate, hydrocortisone, and potent fluocinolone, which is used in ointment, gel, cream and ointment also. So diflucortalone, methylprednisolone also can be used in cream, ointment, and metamizole with potent activity from glucocorticoids, which are used topically on the skin. And very important, it is new drug clobetasol propionate. Remember these drugs which are used topically on the skin. So, and also there is classification due to the chemical peculiarities of glucocorticoids. Natural, I told you about these several minutes ago. It is hydrocortisone, Synthetic drugs. So dehydrated prednisolone, methylprednisolone, which belongs to synthetic agents, fluorinated dexamethasone, triamcinolone, defluorinated fluocinolone acetonide. The name of the drug is Sinaflan. Trifluorinated fluticasone and fluorinated agents beclomethasone, which is a famous drug name, Vicotide. So, synthetic preparations have less effect on what is called metabolism. They are more important as drugs of non-specific therapy. They are stronger and more durable. So we can see with you that hydrocortisone compared to activity prednisolone 4 times upper than hydrocortisone, triamcinolone 7.5, dexamethasone 30 times upper in hydrocortisone. So you have to understand that duration of action of hydrocortisone about 8 to 12 hours. Prednisolone 18-36, triamcinolone is about 48 hours, and dexamethasone up to 72 hours. So the most longer time of action for dexamethasone, and we discussed it during classification due to the time of action. Effects of metabolism. You know that glucocorticoids, natural, they are hormones of adrenal glands, and you have to know all effects of glucocorticoids. If you know, you'll understand the effects on metabolism. Glucocorticoids act intracellular. They interact with specific receptors in the cellular cytoplasm. The receptor becomes activated, and this leads to its conformational alterations. So effects of metabolism, the complex steroid plus receptor penetrates into the nucleus of the cell and binds with the DNA. It stimulates the production of specific mRNA that affects the synthesis of proteins and enzymes. Carbohydrate metabolism. They increase glucose level in the blood. They inhibit hexokinase, decrease the utilization of glucose, increase gluconeogenesis, increase glycogen deposition in the liver, and I want to pay attention that glucocorticoids can cause steroid diabetes mellitus. The name of this disease due to the increasing of the level of glucose in the cases of usage glucocorticoids, it is steroid diabetes mellitus. Protein metabolism. They accelerate protein catabolism, so it means negative nitrogen balance, and inhibit protein synthesis. They delay the regenerative process and growth of the children. So remember that during usage of glucocorticoids, especially long periods of time, they will be influence the regeneration of the tissue during trauma, during operation. So pay attention that they delay the regenerative process. They improve protein synthesis in the liver, erythropoietin, surfactant, lipomodulin, insulin, histamine, and antitoxic liver function. Glucocorticoids are used in the treatment of hepatitis and acute poisoning. Fat metabolism. They cause the redistribution of fat. The name of syndrome which is apparent during usage of glucocorticoids for a long period of time, Cushing syndrome. It means accumulation of a considerable amount of fat on the face. It means crescent-shaped face and dorsal part of the neck and shoulders. What is salt metabolism? They retain sodium in the body. Reabsorption in the renal tubules is increased. It leads to the increasing of the volume circulating blood and leads to the increasing of arterial pressure. Don't forget about it because glucocorticoids can increase arterial pressure and you have to remember about it. Also, glucocorticoids increase the secretion of potassium and calcium. So, glucocorticoids can cause hypokalemia. It means decreasing of the level of potassium. And also, glucocorticoids, they prevent absorption of the calcium in the gastrointestinal tract and leads to the increasing of the secretion with kidneys of calcium. So, and due to the rotation of sodium, they increase in the plasma volume that I told you, that increasing blood pressure. And due to the decrease of the level of calcium, it leads to the osteoporosis. Osteoporosis can occur. And the next picture we can see with you people with Cushing syndrome. So, Cushing syndrome is caused by prolonged exposure to elevated levels of either endogenous glucocorticoids or exogenous glucocorticoids. So we can see osteoporosis, compress vertebra. So due to the long usage of glucocorticoid, it is red cheeks, you can see moon face, then fat pads or buffalo hump, ecchymosis also, then thin skin, high blood pressure, we discussed it due to the increasing of the water salt retention and increasing of blood pressure. Then thin arms and legs, pay attention. So remember that the fat is accumulated upper face, neck, upper shoulders, but arms and legs are thin. Then can see red striation, pendulous abdomen, and poor healing due to the increasing of catabolism of the proteins, which leads to the decreasing of regeneration. The main effects of glucocorticoids. Now we discuss with you inflammation today. So of course glucocorticoids, they have anti-inflammatory, and you can see, you can meet the term and abbreviation steroidal anti-inflammatory drugs. Also, they have anti-allergic and immunosuppressive effect, anti-toxic effect, anti-cancer effect. It is used for the treatment of leukemia, and effect on the cardiovascular system. Anti-inflammatory effect of glucocorticoids. So, glucocorticoids induced by synthesis of special proteins, lipoproteins, and they inhibit phospholipase A2. Do you remember the picture that I showed to you during discussing the mechanism of action of non-steroidal anti-inflammatory drugs? that arachidonic acid is synthesized from phospholipids, and the main enzyme which acts on the transformation of phospholipids to arachidonic acid is phospholipase A2. So glucocorticoids, they inhibit this enzyme phospholipase A2 and leads to the decrease of the production of arachidonic acid and leads to the production of prostanoids, leukotrienes also, because it inhibits not only cyclooxygenase V transformation but also lipoxygenase V from arachidonic acid. Also, it inhibits the platelet activity factor, and they suppress all stages of inflammation, all stages, and they are active in hyperergic inflammation also. So, alteration, they reduce tissue damage, the formation of free radicals, stabilize the cell membrane, the release of lysosomal enzymes, and they decrease the formation of antibodies and immune complexes, their deposition on cell membrane. But this is the mechanism of anti-inflammatory action of steroidal anti-inflammatory drugs that I told you, that they inhibit phospholipase A2 and inhibit lipoxygenase and cyclooxygenase V. Due to the inhibition of lipoxygenase V, there is inhibition of leukotrienes, and the inhibition of cyclooxygenase V, it leads to the inhibition of prostaglandins, thromboxane, and one type of prostaglandins is prostacyclin, prostacyclin. Effects on the cardiovascular system of glucocorticoids. They increase blood volume. Yes, we discussed it due to the increase of water salt retention. They reduce release but increase the breakdown of histamine. And they increase the sensitivity of receptors to catecholamines, normalize microcirculation, improve atrioventricular conduction, increase heart rate, and increase blood pressure. Also, glucocorticoids are applied in shock of any origin, in sepsis, hypoxia, cerebral edema, intracranial hemorrhages, intoxication, hepatitis, and cirrhosis. Natural glucocorticoids are used in acute and chronic adrenal insufficiency, Addison disease. Effects on hematopoiesis. Glucocorticoids increase the amount of reticulocytes and erythrocytes. So they are used for the treatment of hypo and aplastic anemia, hemolytic anemia. They increase the number of neutrophils, reduce the amount of eosinophils, lower the number of lymphocytes, mass of thymus, lymphodenes, and they are used in the treatment of leukemia. So the main indications for usage of glucocorticoids, we can divide it into an intensive care and limited and long-term therapy. So in intensive care, we have to use the drug in all kinds of shock, and especially they use intravenous, and as a desperate measure in septic shock. Their value is doubtful. So also we use it in anaphylactic shock. It is used in swelling of the brain and lungs, sepsis, asthmatic status, serum sickness, and quinquedema or angioneurotic edema, another name of this quinquedema. And the limited and long-term therapy we use in the connective tissue disease, rheumatism, systemic lupus erythematosus, in arthritis. So, corticosteroids are one of the last resort drugs, and to be used in conjunction with non-steroidal anti-inflammatory drugs when disease and disability continue to progress despite other measures. We have to use or to keep dose to minimum. Osteoarthritis, usually we use for treat this disease with NSAIDs, non-steroidal. Systemic usage of corticosteroids is very, very rare. Can be used intra-articular injections of the steroid for control and acute exacerbation. In rheumatic fever, corticosteroids are used in severe case. In gout, corticosteroids in short course should only be used in acute gout arthritis, only in the case when non-steroidal anti-inflammatory drugs have failed to afford relief. Collagen disease, the systemic lupus erythematosus, polyarthritis nodosa, dermatomyositis, nephrotic syndrome, glomerulonephritis, and related disease need corticosteroids. And usage of this drug may be life-saving. So, therapy generally started with high dose, which are taped to maintain dose when remission occurs. We use it in bronchial asthma, in chronic pneumonia. So, you know that I told you that glucocorticoids are used in asthmatic status. In severe chronic asthma, a supplement to bronchodilators. So, inhale beclomethasone or low-dose oral therapies given for all periods. Can use budesonide, also can use fluticasone. And early institution of inhaled glucocorticoid therapy is now recommended in most cases with more than mild asthma. And short courses of oral steroids may be used to tide over acute exacerbation. In the case of acute exacerbation, maybe injections. So glucocorticosteroids are used for systemic usage. Also, corticosteroids benefit aspiration, pneumonia, and pulmonary edema from drowning. Given during late pregnancy, corticosteroids accelerate lung maturation in the fetus and prevent respiratory distress syndrome at birth. Such therapy may be undertaken in premature delivery is contemplated. Also, we use it in hepatitis, in cirrhosis, in nephritis. We use it in eczema, psoriasis, also in transplant and rejection syndrome. So, high dose of glucocorticoids are given along with other immunosuppressant agents to prevent rejection reaction followed by a low maintenance dose. So, and also we use corticosteroids in malignant leukemia. So, corticoids are an essential component of combined chemotherapy of acute lymphatic leukemia, Hodgkin's, and other lymphomas because of their marked lymphotic action in these conditions. They have a secondary place in hormone-responsive breast carcinoma. Corticosteroids also afford symptomatic relief in other advanced malignancies by improving appetite and controlling secondary hypercalcemia. Also, they are used in eye disease. Corticosteroids are used in a large number of inflammatory ocular disease, may prevent blindness. Topical installation as eye drops or ointment is effective in disease of the anterior chamber, and allergic conjunctivitis, uveitis, iridocyclitis. Ordinarily, steroids should not be used in ineffective conditions. But if inflammation is severe, so they may be applied in conjunction with an effective antibiotic. Steroids are contraindicated in herpes simplex keratitis and in ocular injuries. So remember, in herpes simplex keratitis and ocular injuries, glucocorticoids are contraindicated. So also the topical corticosteroids are widely employed and are highly effective in many eczematous skin disease. Exfoliative dermatitis, also in Stevens-Jones syndrome, also these drugs can be used. Also, I want your attention that glucocorticoids also are used in cerebral edema due to tumors, tubercular meningitis, which responds to corticosteroids. Dexamethasone or betamethasone are preferred because they do not have sodium retaining activity, so they will not increase water balance in the human organism. Their value in traumatic and post-stroke cerebral edema is questionable. So large doses given soon after spinal injury may reduce the resulting of neurological sequelae. So on this scheme, we see with you all clinical uses of steroidal anti-inflammatory drugs that we discussed with you one slide ago. So also we use glucocorticosteroids as substitution therapy, adrenal insufficiency, and all these diseases that you see in this slide we discuss with you. Also in ulcerative colitis and Crohn's disease we use it. So in intestinal disease I didn't tell about it. So this is chronic inflammation in intestinal disease, and maybe in phase of remission or in the phase of exacerbation, and corticosteroids are indicated during acute phases. So maybe used orally, maybe enema, and if not responding to 5-aminosalicylic acid compounds and other measures, we have for administer glucocorticoids. So remember these main therapeutic usage, main indications for glucocorticoids. The main side effects of steroidal anti-inflammatory drugs. Of course, if you know all effects of glucocorticoids, you understand the main side effects. It is, of course, susceptibility to infections due to the immunodepressant activity. Delayed healing of wounds, we discussed it, due to the increase of proteins catabolism. Osteoporosis, due to the decrease of the calcium level in the human organism. Growth retardation in children. So remember about it, because even with small dose, if given for a long period, it can lead to the growth retardation in children. Also Cushing syndrome, hyperglycemia, muscular weakness, maybe proximal shoulder, arm, pair with myopathy occasionally due to the withdrawal corticosteroids. Psychiatric disorders, maybe mild euphoria frequently accompanies high-dose steroid treatment. These may rarely progress to manic psychosis. So these may rarely progress to psychosis. Maybe nervousness, decreased sleep, and mood changes. Maybe also, rarely, a depressive illness may be precipitated. Usually psychosis. And don't forget about withdrawal syndrome and suppression of hypothalamo-pituitary adrenal axis can lead to the adrenal insufficiency. Don't forget about contraindications for glucocorticoids. It is peptic ulcer, diabetes mellitus, hypertension, viral and fungal infections due to immunosuppressive activity, tuberculosis and other infections, osteoporosis, herpes simplex, keratitis, psychosis, epilepsy, chronic heart failure and renal failure. All these diseases, remember, they are contraindicated for glucocorticoid usage. On this slide, I want to explain to you how to use glucocorticoids and better to use it in the morning. Do you see these tablets? So, of course, better to use in the morning. To use the dose, it is excellent, preferable until 8 o'clock. Why is it better to use glucocorticoids in the morning? So, it is used in the morning to prevent adrenal insufficiency. There is synthesis of hormone, and you have to remember about feedback. What does it mean, feedback? If you give dose of hormone in the morning, then the quantity of hormones will be decreased. Do you see? The concentration of hormone will be decreased. Then the impulse will go to the hypothalamus in the case of decreasing of the level of glucocorticoid natural diet in our organism. Hypothalamus will facilitate impulse to hypophysis to release of adrenocorticotropic hormone, and releases of adrenocorticotropic hormone will stimulate the natural glucocorticoid. So, and the level of natural glucocorticoids also will be increased in the morning, will give in the morning glucocorticoids will get effect of these drugs, then they will be decreased, and opposite negative feedback, impulse to the hypothalamus and stimulation of natural glucocorticoids. And of course, I want to pay your attention that we cannot stop to use glucocorticoids immediately because we are afraid of withdrawal syndrome. How to prevent this withdrawal syndrome? We have to decrease the dose of glucocorticoids gradually. We cannot stop to use it immediately. It is a big mistake of the doctor. So you have to explain to your patient how to use the drug and to prevent the main side effects of this drug: adrenal insufficiency and withdrawal syndrome. On this slide you can see contraindication that I told you during discussing the side effects of the glucocorticoid, and say no to any drug formulation combined with steroids. Remember that steroids are life-saving drugs, but they have a lot of side effects, and know the following conditions where you have to be extremely cautious: peptic ulcer, contraindication in the case of exacerbation. In cautions you can be during hypertension and diabetes mellitus. You know that nowadays during COVID disease, glucocorticoids are used very, very often, and very severe situation, and the patients is characterized for the patient with diabetes mellitus, and usually they are suffering not only from diabetes mellitus but also from hypertension. And during an administration glucocorticoids during COVID for prevention of cytotoxic storm, it is obligatory to control for all people arterial pressure. And if you know that the patient is suffering from diabetes mellitus, also it is obligatory to control sugar level to prevent complication of this disease. Also in viral and fungal infections, they are contraindicated, and osteoporosis and epilepsy and psychosis, and I told you that chronic heart failure and renal failure are contraindications for usage of glucocorticoids. The main antagonists of glucocorticoids, Mediators, which inhibits 11-hydroxylase in adrenal cortex and prevents synthesis of hydrocortisone, and also the glucocorticoid antagonists that you have to know. This is antiprogestin. The name of this drug is mifepristone, and mifepristone acts as a glucocorticoid receptor antagonist as well. So it has been used in Cushing syndrome, but blockade or feedback of adrenocorticotropic hormone inhibition leads to oversecretion of adrenocorticotropic hormone, and more hydrocortisone is produced, which tends to annul the glucocorticoid receptor blocking action on the mifepristone. So remember, two main antagonists of glucocorticoids, there are metilapone and mifepristone. So I will try to explain to you the main two groups of drugs which are used in inflammation. We discussed with you and the non-steroidal and steroidal anti-inflammatory agents, which are used very common in any specialty of doctor which you choose. You'll use this group of drugs, and you have to remember about the main effects of these drugs, about side effects of the drugs, about interactions And of course, don't forget about contraindication of this drug. All these things we discuss with you. I tried to pay attention to discuss fully. And if you have a question, ask me question. And now our lecture is finishing, and I want to tell you thank you. We'll see you. Goodbye.